Hello, my name is Leslie.
I'm Anna.
And I'm Sherra.
And today we're going to talk about the autoclave. First, let's talk about why and when we use autoclave. We use autoclave for the sterilization of surgical instruments. Depending on certain medical facilities, instruments may be sterilized every day in a hospital setting, but for some doctor offices, instruments are usually sterilized once a week because there are not many procedures that are done compared to the hospital.
Next, we're going to talk about wrapping the instruments. This one is the Muslim. The instruments are sterile up to 28 days. And this one, the plastic wrap, is sterile up to 6 months. We're going to demonstrate how to wrap some scissors. First, you will need to put this paper card inside so you will know what are you wrapping when you take it out. And you will realize when it's black, it's already sterile. So place your scissors in the center, fold this out, fold it, fold your tab, fold this, fold your tab, fold it again, fold your tab, fold this up, fold it again. If it's too big, fold it again if you need to. Bend your tab. Do it again. You will need a little piece down, so when you're ready to use it, just pull the tip up. You get your piece of tape, place it in the middle. You'll realize when it's sterile, this will turn dark brown. Afterwards it's ready, you will hold the tip up, peel it off, keep going. You can only hold the side tabs, pull it out, and you can go ahead and ready to use. Make sure before loading the autoclave, label your instruments with your initials, date, time, and what it is.
Loading the autoclave is a very easy process. First, you have to make sure you have your instruments all the way wrapped and that they're loosely wrapped so that the steam can get into the inside. And that they have their indicator strips on it also, so you can tell if the instrument has become sterile. Then we're going to go over here and we're going to make sure that you put a cup of water to soil waste in order to create additional steam. Make sure that there's no instruments in the autoclave before using it. If there are, just take them out and start a new process. You can fill these trays up. Don't fill them too full, but you can fill them somewhat full. As you can see, this tray has a couple that are wrapped, and we also have the plastic wrap in there. So since this one is already full, we're going to go and we're going to use the top rack. There should be at least 2 racks in there to use. So we'll pull the top one out and we'll slide that in there, slide that back in. So you place them into the tray and you can fill them all the way to the top like I said. You have to make sure that the temperature is between 121 degrees Celsius and 123 degrees Celsius. The color change is usually displayed on there. They'll appear on the tape when the proper temperature has been reached. It's a little difficult to close the autoclave, so I'm going to show you how to close it. Once your instruments are in there, there's a finger hole, you're going to pull back all the way you can. And you're going to go, push it in as far as you can. Now right here you'll see there's a little knob and it'll attach right there. And you pull this all the way back and you'll hear a pop. And that means that it's securely closed. Afterwards, to open it, you pull the black panel back, all the way back. And then you're going to again pull all the way back and open it up. So after you have your temperature to set to about 121 degrees Celsius, you want to make sure that you run the autoclave for about 15 minutes. When you're done, you need to make sure that the indicator strips are colored or the cycle did not go all the way through and none of your instruments are sterile.
Due to high heat and pressure created in autoclaves during operation, proper loading, use, and unloading procedures must be followed to prevent burns and other accidents. So, you don't want to interrupt the autoclave before the 15 minutes is up. Depending on certain other kind of autoclaves, it may be longer times, but you never want to interrupt. So once the 15 minutes are up, you want to stand behind the door when opening. Then when we open, you don't want to open it all the way. You just want to open it far enough to where the steam is able to escape out, so it won't be so much steam when you reach in there or pulling the tray out and get burned. After about a minute or so, you can open it up all the way, and it should be cool enough to be able to pull instruments out.